The forms of general anesthesia in cattle and commonly used drugs and drug combinations. So when doing anesthesia in cattle, we want to have a short induction time, as well as IV with minimal assistance and small volumes of drugs, and drug combinations to decrease the dose and side effects. What we don't want is difficulty to control the depth of anesthesia, as well as difficult respiratory support and difficult accurate weight, as well as a slow recovery. This happens in intramuscular and subcutaneous anesthesia. With cattle, we want a short withdrawal period. This is because they produce milk and meat. The complications that can occur is low lung capacity. This is from pressure of abdominal organs in dorsal or lateral recumbency, as well as ruminal reflux, which can cause aspiration pneumonia. The cardiac sphincter muscle becomes relaxed during anesthesia. So the first combination is the ketamine stun, also known as the K-stun. It's done when the patient is still awake and there is mild pain, but the patient is more cooperative. And it's given as xylazine and ketamine together, and it can be given IV, IM, or subcutaneous. It's done for standing surgeries in large ruminants, as well as recumbency in small ruminants. Intravenous is a faster onset and a high level of analgesia and sedation. Subcutaneous has the shortest duration. For the IV recumbent stun, this is when you give xylazine, ketamine, and butorphanol together. The onset is 1 minute and the duration is 15 minutes in recumbency when they have analgesia. In standing, it can last 20 to 25 minutes, but local lidocaine is needed. But if you're doing an intramuscular or subcutaneous recumbent stun, it has a longer duration and less analgesia. So same as last time, you give xylazine, ketamine, and butorphanol. However, it's a longer onset of 5 minutes, and the duration is 45 minutes, which is longer than the IV one. And in a standing surgery, it can last up to 90 minutes. For an intravenous standing stun, this is to improve patient cooperation. You give xylazine, ketamine, and butorphanol. And an intramuscular or subcutaneous standing stun, this is done for a standing procedure like a C-section or laparotomy. You give xylazine, ketamine, and butorphanol. And then the 5-10-20 technique is given in intramuscularly or subcutaneous. In an adult cow, you give 10 mg of xylazine, 20 mg of ketamine, and 5 mg of butorphanol. So the butorphanol is 5, the 10 is xylazine, and the ketamine is 20. The onset is around 5 to 10 minutes, and the duration is an hour to an hour and a half. Local lidocaine is needed. So the main drugs are xylazine. It's a good sedative, a good analgesic. It can be given through all routes, IV, IM, and subcutaneous. Ketamine and butorphanol are analgesics, and they're both given IV. For ketamine, you give it after sedation with xylazine, and butorphanol is best with xylazine. Painkillers that you give to dairy cows are ketoprofen and carprofen. These are NSAIDs. This is because they don't have a withdrawal period in milk.